So we've just heard 4 outstanding presentations about the impact high-resolution imaging can bring to the clinic for the benefit of patients. Now for the crowning presentation, we're very pleased to have Dr. Sanjiv Gambhir bring it all together in his lecture on high-resolution imaging and the future of data sciences in radiology. Dr. Gambhir from Stanford is the Virginia and D.K. Ludwig Endowed Professor for Clinical Investigation and Cancer Research. He is professor in radiology, bioengineering, and material science and engineering. At Stanford, he's an active member of the Cardiovascular Institute, the Cancer Institute, and the Neurosciences Institute, as well as BioX. Dr. Gambhir is the director of the Molecular Imaging Program at Stanford and chair of the Department of Radiology. Last year, he was appointed Director of Precision Health and Integrated Diagnostics. Among his many awards, Dr. Gambhir has received the Tesla Medal from the UK Royal College of Radiologists, the Hounsfield Medal from the Imperial College London, the Parmalee Prize from the American College of Cardiology, and the J. Allen Taylor International Prize in Medicine from the Robarts Research Institute. The RSNA granted him the Outstanding Research Award in 2009. Dr. Gambhir is a fellow of the National Academy of Inventors and the American Association for the Advancement of Science. He's a prolific publisher and serves on numerous academic advisory boards for universities around the world, as well as the Board of Scientific Advisors for the National Cancer Institute. He's founded or co-founded several startups in the diagnostic space, one of which is now publicly traded. I could go on and on listing his achievements, but I expect you're ready to hear his words of wisdom and probably get onto some food. So without any further ado, please help me welcome Dr. Sam Gambhir.
Well, thank you so much. It's a great honor to be here this evening. It's a great honor to be invited by leadership at Toshiba. I'm not sure I'm going to tie any of the talks together, but I will certainly tell you a little bit about the way we're thinking at Stanford University around a new model for what we're calling precision health, which is in direct contrast to precision medicine, which is the term you hear most often around the world. This vision is based on the fact that most of us in the room and most of the medical community around the world is really very reactive rather than being proactive. What we spend most of our time doing is treating disease, and that too disease that's quite often caught very late. And we want to begin to change this paradigm by bringing together scientists and physicians that can start to make healthcare much more proactive. So to do this, we're looking at strategies in which we can assess risk of disease at a very early point in life, including right after the time of conception. Because fetal DNA is available in maternal blood, we're actually able to assess risk even while the fetus is growing in the womb. Genetic history, socioeconomic factors, all of these are brought together to form a risk profile that will follow you throughout the rest of your life. This then is leading to customized monitoring. Why should Mr. Jones be monitored the same way as Mrs. Smith? Each one should be monitored throughout their life based on diseases they're at risk for, not a generic assessment of what risk a population's at. This involves a revolution in wearable diagnostics. I'll show you examples of even how imaging will be worn in your clothes. Smart home technologies that are emerging at a very rapid pace, especially in Silicon Valley. Biomarkers, molecules that tell us how your body is evolving, and large-scale studies like the Google Baseline project that we'll talk about. And then imaging and implantables that we think will change how we detect disease at a very early stage. This then will be married to a significant amount of data analytics, not just the machine learning that we're hearing about here at RSNA that's around machine learning and AI of images and image interpretation and image assistance, but really machine learning that takes care of all the data throughout your entire life, and how new models, including models that are being referred to as the digital twin, is a model of your body in the digital domain and how that twin evolves based on environmental factors it's exposed to. And then that will lead to, in many cases, hopefully prevention of disease, and if not prevention, early detection. And that will then lead to, hopefully, interventions at the earliest possible time. All of this is being done through an integrated health portal. The integrated health portal is a massive AI machine learning system that takes data from multiple domains. It's sort of the Internet of Things on steroids, but brings together information across all these domains to, in fact, watch you evolve over your life. This, then, a process that's also helped by lifelong surveillance, learning, and adaptation. We do a great job in most countries teaching about physical education, but we don't do a great job teaching about health education from the earliest point in time, from a young child that's only 2 or 3 years old. How do you take better care of your body? How do you learn to do that throughout your entire life so that you achieve a vision of precision health? So unlike precision medicine, which is focused on what is the right medicine for the person at the right time, this is around how you change the dialogue away from medicine to health and keep people healthy for the longest possible period of time. This is not new to other industries. Next time you're in an airplane, look carefully at that jet engine. That jet engine has evolved the same way that I'm proposing on that last slide for the human being. Each jet engine now has hundreds of sensors that monitor the engine's health every 30 seconds. That information is not relayed to the pilots. It's actually relayed to a health portal on the ground. And that health portal makes continuous tweaks in the engine without the pilots even being involved in the loop. And of course, if there's a serious problem in the engine is warranted to be brought down to earth through the pilot's intervention. The way this industry has evolved is the same way we're starting to see the health industry evolve. Many of the things in AI machine learning in this space are also impacting us. We work a lot with the jet engine industry to look at the lessons they've had and how to deal with false positives. How do they use AI and machine learning to figure out when their sensors are giving a real signal versus an artificial signal? And so this is not something that you wave your hands about. It's very real. If you look at a jet engine, although much, much less complicated than a human being, the way these sensors have evolved include things like physiological monitoring, temperature, pressure, but even molecular monitoring occurs in a jet engine. The exhaust has nanoparticles in it, and the size of the nanoparticles and the shape helps you understand damage that's going on deep within the engine. And then, of course, data analysis of all of this is occurring, as I mentioned, in real time. And because of this, the jet engine industry has fundamentally revolutionized early failure detection and prevention. You will still hear of engines that explode. You will still hear of problems. But there's been a massive savings in the jet engine industry by moving towards these near continuous monitoring strategies. And we think the same thing will start to occur in the human being. That you will have, of course, physiological parameters, like you're seeing now with things that you wear with a Fitbit or other Apple Watches that measure things that are what I would call more physiologic. But you will also see more molecular monitoring, including devices that will monitor molecules within your body for the hopes of detecting early disease. And the data analytics, there are many parallels of. The data in the jet engine industry currently in the US generates several petabytes of data per day based on all the 28,000 or so flights in the air in the US at any given time. Similarly, the data challenge for the human being to be able to look at many, many variables like we're going to talk about includes significant amount of data, but still nowhere near the data that you actually get from every 30-second monitoring of a jet engine. So this is all leading to a revolution in devices, more than you've heard about in the common press. Being in the heart of Silicon Valley, we are seeing an explosion of small companies that are pushing the boundaries of what you think may be detectable or not. And of course, at Stanford, including some of the things I'll show you, we're developing some of these next generation technologies that are designed to detect what's going on deep within your body. Two examples that I'll briefly highlight are the smart contact lens and the smart bra. The smart contact lens is a lens that allows you to perfectly see through it. So although you see a lot of devices, including a solar cell module, electronic components, biosensor module, and even a module for conversion of power, all of that is built into the lens. Why? Because your tears are a great source of biomarkers such as glucose. And by monitoring glucose in your tears, you can hopefully indirectly know glucose levels in the blood. How much do you think that contact lens costs? How many people think it costs between $100 to $500? Raise your hand. This is where you get to participate. All right, very few. $500 to $1,000. How many people think it costs over $10,000? Okay, so most of you think it's about $500 to $1,000, and the rest of you are too scared to raise your hand. It costs 3 cents, okay? And because technology in high production drives down prices, these technologies are very rapidly evolving now. And they're already deployed in clinical trials. This one in particular is being used in diabetes trials with Novartis. The second technology, which we're developing in my own labs, is a smart bra. In this continuous monitoring world, why should you have to go in for a mammogram at a certain frequency when we have the ability to measure breast tissue health near continuously? We do it through photoacoustics, which I'll talk about, and which actually Canon was pursuing long before Canon and Toshiba came together in the acquisition. And photoacoustics proposes an entirely new way to interrogate tissue, and we'll talk about that. But our smart bra technology is based on that particular form of interrogating living tissue. Now, this is very rapidly growing. What we're seeing are projections in revenue shown in red and in shipments of the global wearable markets as a very significant growth, reaching in 2021 about $95 billion. And so this is not a small market. But there's a problem. Most people don't really continue to wear their wearables. You still have to change human behavior. On average, people wear a Fitbit for about 6 months before they no longer wear it reliably. So we've always thought the answer is not really going to be around wearables alone. We think the bigger answer lies in your house, and that technologies that will be deployed in your house will fundamentally allow us to measure your inputs and outputs, and fundamentally let us monitor you near continuously over many, many years. So we're building such technologies, and so are other groups around the world, and this whole area is also very rapidly accelerating. For example, in my own labs, for many years, we've been building smart toilets. If you think about it, you don't have to get anyone's behavior to change. Everyone's going to use the toilet, guaranteed, okay? There is no doubt about it. I can tell you over drinks how we know it's you that's using the toilet, if you like. The toilet, in this case, lets you measure DNA in the stool, lets you measure many biomarkers in the urine, lets you detect urinary tract disease, lets you detect disease that's related to colorectal cancer, bladder cancer, many, many diseases. It's based on a chip we developed that's known as the magneto nanosensor that is now commercialized in MagArray that's being used in multiple applications, including the smart toilet technology. And so these things are coming. This one is actually getting ready to deploy in clinical trials now, and there's several smart toilets, including, of course, the world's leader in toilets, Japan, where Todo has been pushing technologies to develop this next generation of toilets. And it gets even more interesting. What's another thing that you use in your bathroom every day? You look in your mirror every day. And there is fundamental advances in mirror technology, in this case, the WISE mirror, which actually does full multispectral imaging, face, your neck, and looks for subtle changes, just like you know when someone's getting a little ill by just staring at them. The mirror is able to analytically look at changes that are leading to acute illness as well as chronic illness. And these technologies, this one is now deployed in over 1,000 homes in the European Union. It also has a volatile organic compound detection system for exhaled breath that's looking for biomarkers in the breath. And it actually gives you a score every morning. This person got a 34, okay? It gives you a health score based on taking all of these measurements that are actually occurring. And when you can measure something serially over time, repeatedly looking at very small changes, you're able to unmask disease that you would have otherwise missed. Well, imaging is going to be challenged a lot by these tools because although we continue to do better, will we do well enough when these tools detect presence of disease? What if the disease is still so low in burden that we are unable to image it? And so we have seen this phenomenal evolution, as shown in this slide, from radiological imaging now to molecular imaging. And there's still a next generation of technologies that we and others are building. And I'll just share one example of those because of time with you. But there's many emerging. If you thought we're done interrogating living matter, that there is no other way, there are many new ways. There is magnetoacoustics that is coming. There is RF acoustics. I'll show optoacoustics. And all of these have this one limitation that they tend to be more regional approaches. They don't tend to be whole body solutions. You sort of have to know what part of the body you want to image, like what we heard in the great talk with ultrasound. But they can achieve resolution levels that we haven't seen and at cost levels that are extremely low. And so just to highlight one of these, I'll focus on photoacoustic imaging. Photoacoustic imaging actually originally was discovered by Alexander Graham Bell, who filed the initial patents for this particular form of detection. In this case, you're using pulsed lasers to actually use light excitation that you can get in the near infrared to about 4 to 5 centimeters depth. That light penetrates into tissue, you get absorption of the light, you get slight heating, and then thermal expansion, and that leads to pressure waves and acoustic detection. So it's light in and sound out. So it's not quite ultrasound, and it's not quite optics, because it has both components embedded. It still has advantages and disadvantages. Because of ultrasound's limitations in air near bone, you're going to have that limitation, for example, for a whole body scanner. It does have significant advantages of high resolution multiplexing because you can change the wavelength of the excitation light. It has relatively deep penetration, 4 to 5 centimeters, and specificity can come from molecules that are injected into the person. Just like you would inject a PET tracer, you can actually inject a small molecule that's very dark that will absorb light and produce sound. But that small molecule can be targeted, for example, to a cancer cell surface biomarker. These technologies are very rapidly evolving. In fact, Canon was working with Stanford a few years back looking at photoacoustics. This particular technology, in this case, this is the first human breast ever imaged with photoacoustics. This is a 30-second acquisition, and the top of the breast is the top of the image, and the bottom chest wall is the bottom of the image. Why you're seeing what looks like vasculature is because hemoglobin and deoxyhemoglobin are absorbing light and producing sound in the process. It has a resolution that's 200 microns, 5 centimeters of depth, and this is still not the absolute best achievable. We're in the very early days of this. In this case, no molecule was injected. There's no contrast agent, but we have many such molecules being developed that are in the pipeline for FDA approval that are designed to target specific molecular events. So we think promises of technologies like this are significant. They have variations. You're going to hear a lot more about magnetoacoustics, in which magnetic fields lead to sound, and also RF acoustics, where radio frequency is sent in to produce sound, and that does not have some of these same depth of limitations. So it's a very exciting time for radiology. We are seeing an explosion in all elements of precision health. You know, at this meeting here at RSNA, we're seeing so much in the area of AI, machine learning, and big data This is, of course, a very important area for our entire field where no one knows exactly how it's going to evolve. I think the answers lie in part in first understanding human health. We have always argued that one of the reasons we don't do a good job with illness is that we don't really have an understanding of human health. What we need is a movie of your life long before you become ill. So this study, which we launched with Google and Duke, is the single largest study of human health. It's now approaching a cost of $1 billion. It is available to any of you. You can go to projectbaseline.com and enroll in this study. You undergo a several-day series of evaluations, including everything about your genome, your microbiome, imaging, of course, bodily fluids, your saliva, your tears, stool, blood, you name it. It's about the most comprehensive analysis of a human being that's ever been attempted. And then that's serially followed over time. That then leads to a very comprehensive study of understanding what human health really is. How can we really treat disease and illness till we can first find ways to understand what health is? And we're hoping this longitudinal cohort study will be the Framingham study of the next century. The idea is initially 10,000 subjects that are being enrolled, but we hope to take it up to 50,000 subjects based on increased funding. Why is a study like this so expensive to do? It took us many years to work and convince companies like Google to invest in this because it's such a deep dive on each subject. The amount of testing that has to occur on each subject leads to costs that are tens of thousands of dollars per subject. But we're very excited that this will become what will be hopefully a Framingham-type study in which you can pose hypotheses to the data set to interrogate the data set and then do additional studies to actually conduct a formal clinical trial. And I want to end by saying that I know a lot of you are wondering as you walk around RSNA, what's going to happen with, in the meantime, AI machine learning in the general area that we're all impacted by running and working in radiology departments or radiology private groups. And Toshiba, in this case, has some great presentations actually tomorrow. And in this case, it's all related to new insights. For example, I encourage you to look at Automated Insights, which is a system that helps clinicians work more efficiently. It does this by continuously monitoring all aspects of different clinical systems. You can, for example, put together imaging studies with prior imaging studies, medical history, lab test results, genomics, path reports, progress reports, data from similar patients so that you can evolve the healthcare learning system. I believe personally the secret of AI machine learning will not be about the next greatest algorithm to automate chest x-rays or to automate stroke detection. It will be around the groups that are able to champion the infrastructure to be able to combine data sets. And that's what the Automated Insight system is doing. It will selectively run algorithms in the background to classify and characterize data with high specificity. It will store these results, findings, even predictions. While you're reading studies, why not flag a study to say, watch this particular study for potential risk of an abdominal aneurysm, et cetera. More data and algorithm results are produced, this Automated Insight system will refine its findings and predictions. This is already in practice working. This, for example, is Automated Insights and an example from it, which as you're looking at and getting ready to look at a given study list, the algorithm detects a pathological condition with high confidence and alerts the reader, in this case, the radiologist. In this case, it detects an abdominal aortic aneurysm, in contrast enhanced abdominal CT. It detects and quantifies coronary calcium in non-contrast chest CT scans, and detects and segments hematomas in non-contrast head CT scans. All of it occurring in the background, not to replace the radiologist, but to assist the radiologist in succeeding and making them more efficient. This is already making its way into, for example, early ischemic changes in non-contrast CT, and calculating specific scores to let us know when there's a potential score risk, in this case for ischemic changes. And just like a radiologist would learn from experience, these methods will learn through convolutional neural networks, and they will take advantage of symmetry or lack thereof in the brain and align atlases and data sets through landmarks. So I encourage you to look at these and other systems. It's very hard to predict how all these are going to play out. If you open the Wall Street Journal just from this morning, the front cover of the Wall Street Journal is a Stanford project with our radiologist Matt Lundgren, which are new algorithms to automate chest X-ray detection work. That work, other work, is rapidly changing. Companies like Google, Google Brain, many players are coming into this market. I think they're underestimating the regulatory challenges for software like this. They're also underestimating the value that domain expertise in radiology brings. But the infrastructure and background, if we can enable success in that area, we can hopefully all succeed. So to end, I've given you a little flavor of what we're envisioning at Stanford around precision health, how we think it will begin at a very early stage. I highlighted just a couple of examples, including the smart bra for imaging, the smart contact lens, but there's many, many other things coming, and they're very similar to what other industries have done, like the aviation and jet engine industry. And all of this, along with the data analytics, will hopefully lead to a better future for all of us and for generations yet to come. Thank you very much.